Brace yourself, 'cause the earth is shaking. Feel it all around. Face yourself, now the mirror's breaking into pieces on the ground. Don't you know you gotta let go, turn off the cell phone. You don't need to conversate anymore. Take control, you gotta let go, turn off your cell phone. You are your brother's helper, we are each other's shelter. We can move the world together, give the world a little shake. We are the earthquake. We can change the world forever, give it just a little shake. We are the earthquake. Everybody has a stake. We are the earthquake. Brace yourself, can you feel the thunder rolling underground? Face yourself, is it any wonder that the mountains are all tumbling down? Take a stand, you gotta reach out, turn off your cell phone. You don't need the status quo anymore. Take my hand, reach out, I'll never let go. We are our brother's helper, we are each other's shelter. We can move the world together, give the world a little shake. We are the earthquake. We can change the world forever, give it just a little shake. We are the earthquake. Everybody has a stake. We are the earthquake. Everybody has a stake. We are the earthquake. Stay together, we stay here. Never be breaking. 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 Stay together, we stay here. Never be breaking.
Since 2012, we at KPJ Healthcare College has been working very hard, offering the courses that we offer, the new courses from the level of bachelor to master's, PhD, and also the medical specialist training program. We have successfully run the new healthcare bachelor programs, and I would like to highlight that we have successfully graduated the first batch on time, and this is a testimony of the hard work and quality teaching and training of the staff, academic staff, and also the hardworking students that we have.
studying in KPJUC with practices in KPJ hospitals has got me used to great facilities and technologies that shaped me to become a good physiotherapist.
Nursing has been our forte since we started the nursing school back in 1991 with diploma in nursing. In 2014, we started our Bachelor of Nursing.
KPJUC has been here longer than my age, so I decided to pursue my dreams due to its good reputation and higher chance to get a job as soon as I graduated.
We are proud that in 2016, we have our first graduates of Masters in Nursing, which brings our nursing school to a higher level of education school for nursing. So our nursing school at KPJUC is now an elite group of nursing school that offer all level of nursing courses. I would like to have a special mention on our Bachelor of Pharmacy. This program has been accredited by the Pharmacy Board of Malaysia in 2017.
A very good afternoon to everyone who are currently watching us now live on YouTube and Facebook of KPJC. Today, I'll be your moderator and my name is Viren Hajrai. I am a Foundation in Science student here in KPJUC. For the audience's information, the title of our webinar today is Sexuality Issues in Autistic Children. And this is a webinar organized by the Student Representative Council of KPJUC. Before I pass on the live to Madam Ruth, I would like to give the audience a brief introspection, maybe scratch the surface a little bit about sexuality issues with autistic children. Autism or autism spectrum disorder, more commonly known, refers to a broad range of conditions characterized by challenges with social skills, repetitive behavior, speech, and non-verbal communication. Because autism is a spectrum disorder, each person with autism has a distinct set of strengths and challenges that they will face, that they have to circumvent. Several factors may influence the development of autism, and it is often accompanied by sensory sensitivities and medical issues such as gastrointestinal disorders, sleep disorders, as well as mental health challenges such as anxiety, depression, and attention issue. There is a great quote by Dr. Stephen Shaw, which says that if you've met one person with autism, you've only met one person with autism. That was a brief introspection about the general knowledge on autistic sexuality issues with autistic children. So today we are very fortunate to have our wonderful Madam Ruth she's a CEO from Ruth Training and Development Academy. Good morning, Madam Ruth. How are you today?
Good morning. I'm fine, thank you.
Thank you for joining our live today, Madam Ruth. Okay.
Pleasure.
Before I pass on fully the live and remove myself from it, I would like to give a brief introspection about Madam Ruth herself. Okay. Madam Ruth is an entrepreneur, a lecturer, a trainer, and also is the CEO and the founder of Ruth Training and Development Academy, which is its base in Klang. She empowers learners with outstanding knowledge and tools of dealing with autism through her slew of different workshops that she holds. Madam Ruth has a background in law with an LLB Hons from UK, a master's from University Malaya, and as a lecturer, trainer, volunteer in autism, has created a large impact in her teaching methods. Madam Ruth has been lecturing for the past 35 years in several areas ranging from autism, psychology, legal English, and also in Moet. Her continuous passion in autism is a current pursuit where she is going nationwide to help educate teachers, parents, and anyone who wants to better glean the autism spectrum disorder. Before I pass on to Madam Ruth, there is you all can see there'll be a link in the comment section below of the questionnaire that Madam Ruth has wants to share with you all to help glean better and procure the relationship between parents and their autistic children. So, Madam Ruth, can you elucidate more on the contents of this questionnaire?
Sure. Thank you very much, Viren. Good morning to my lovely audience, comprising people from all walks of life. With regards to this little questionnaire, I wish to say, or I wish to just very quickly tell you why. In my pursuit, in my PhD in autism at University Malaya, the vision is to develop a module specifically for parents. So your kind input on your attitude, on your practices, and your knowledge of autism, if you could kindly just fill up, it will only take you 10 minutes. I would be really appreciative of that gesture. Thank you.
Now hold your horses, everybody. Don't forget, we have a comment section below. Don't forget to ask the questions. I will be sharing them with Madam Ruth at the end of this sharing. So without further ado, I would like to pass the session on to Madam Ruth to explain on the slides about sexuality issues in autistic children.
Thank you very much, Viren. Good morning, everyone. Sexuality and autism. Even before we get into the word of sexuality, let us understand what you mean by sexuality. When we talk about sexuality, there is development that occurs within the physical line and also the emotional line. Let me give you little parts of it. Our thoughts, our feelings, of course, our behaviors, relationships, our roles, who are we, our identity, and our personality. If we actually look at the word sexual, sex, when does that feeling grow, or when does it really trigger? So research as an educationist in autism for the past 15 years, it shows that it starts as early as 2.5 to 3 years of age. Now, as that feeling grows and as the child develops, what part of our body controls this feeling? Beautiful people, even before we go into depth of that word, let's just analyze the word love. Are we looking at epithemia, which is lust? Are we looking at agape, which is when you show care for another individual? Or eros, all right, that is a relationship between husband and wife? Or filio, that is brotherly love. Now, at this point, we must understand, we have to use, or I will be using the word when you talk about the past tense, or the word in Greek, it's arios, right? Which means I am going to take you through a series of our anatomy in general, because of constraint of time, that shows how it is already enshrined or incorporated in simple understanding. If we look at the brain, all right, we can see that is our CPU, or our center that controls all our movement. So, for example, when we look at this brain, what comes to our mind? I'm going to simplify it. So, we have lobes, we have the temporal lobe that coordinates your language, you got your occipital lobe that does with vision, and then you got your different parts that deals with your thinking. For example, let me give you an example. So I want us to visualize what it would mean, first of all, to be on the spectrum. What part of the child is affected? So if I take, for example, now I'm speaking. So there is a part in the brain that coordinates language, Broca, the Broca's area. So what happens is, let me give you an example. Let's say in this true life example, this particular lady who was very able met an accident. After she met that accident, her Broca's area, that means the part that actually produces language, was affected. No doubt, her vocal cords and her mouth was not affected, but this is very important. Her ability to process words, her ability to reciprocate, her ability to communicate, to come up with words was very difficult. But she could get into a routine, right? Does it stop there? When you look at the definition of autism, it's a complex neurodevelopmental disorder. When we say complex, we are talking about billions of neurons. And when we talk about neurons, what is the function of a neuron? Even the fact that we are listening to each other now via technology, a lot of neurons are being activated. And these neurons, to put it simply, helps us to raise our hand, perhaps, maybe to reach out for an apple, maybe to touch the book, because messages are constantly being coordinated. So the core of communication will be a simple cell. I remember when I was doing my master's, there was one area that I went into a little bit of depth, and that is the myelin sheath. And when you talk about the myelin sheath, when there is a little bit of proliferation, just a teeny weeny bit of proliferation, you would find that the ability to pass signals will be disrupted. Beautiful audience. This part of the brain, just now, very briefly, we looked at the temporal lobe, occipital lobe, right? I just went through very briefly. But there is another part of the brain that helps each of us function. When I say function, that means to live in society, to assimilate into society, which is innate and which we are actually born with. The theory of mind, the theory of executive functioning, and the theory of central coherence. Let's take the key area, the theory of mind. Now, on my slide, it says high order theory of mind. That means to reason. Complex social thinking, deception, not insight. And yet it also talks about deception, the inability for children on the spectrum not to be able to comprehend deception. And this is the most important element. From that ability to perceive, we get into a relationship. Look at the key words: a relationship, which is a noun, and the understanding of each other. Let me give you an example because it may sound very technical early in the morning. So, for example, I know I'm going to come online. So what do? My theory of mind tells me, all right, let me log on, let me prepare the slides, let me go in 10 minutes earlier, etc., etc. Imagine a child on the spectrum. In a short while, I'm going to just give you in depth about autism, all right? But I just want us to have a little preview. Imagine a child goes to school, and if his or her theory of mind is disrupted, the child does not know, perhaps, maybe, we always use modal verbs, that today there is an exam. Or what should I do if somebody actually borrows a pencil from me? Do I retort back? How does the child react? And imagine a child who is nonverbal, who is not able to express. So research has showed, scientific research, there is a disruption in the theory of mind, the theory of central coherence, to be able to look at the bigger picture. Mom's late today. She's not picking me up from school. Am I going to have a meltdown? Am I going to have a temper tantrum? Or do I psych myself? It's okay. I will take a book and read. Or perhaps theory of executive functioning. What do I do when I go to school? I have to have my shoes ready. I have to have my socks. I have to have my books. I have to have my colors. I have to prepare for the exams. So this part of the brain helps us function. Now, does it end there? We have another area where we need our chemicals. So we are talking about our anatomy, we are talking about physiology, and we are also talking about biochemistry. So we are talking about, for example, is everyone excited to listen to me now? Is the dopamine all at its peak, it at a high level? The reward? What about the endorphins, the part that actually tells us on the pain? What about the melatonin? What about the oxytocin? Oxytocin is normally, for example, let me just take one chemical. When a mother delivers a child and they bond together and the trust is built as the mother feeds the child, is that chemical being activated? There is a trust relationship. Or another very sad scenario where the child is left aside, abandoned. What happens to the child? So, in short, we can see when they said autism is a complex neurodevelopmental disorder, it is important for us to understand first how complex we are. Briefly, we looked at the brain, we looked at the emotions, we are looking at the thoughts. So, that means number one, our thoughts, which is the power. Because we must remember the mind will tap the brain and then the brain will start sending signals. Okay, take the book because my thought is I want that book. And the emotion works along with it. Am I excited to sit in the biology class? Am I overwhelmed with enthusiasm to listen to the chemistry teacher? Emotions, the amygdala, the emotional part of the brain, and body. How does your body react to it? Do you react to it positively? Do you react to it negatively? And then we come to this key word, behavioral reality. You see, autism is such, it manifests in the form of behavior. Let me give you an example. It's always good to tell a story in the morning. This particular individual goes to a preschool and informs the parent that the child could be on the spectrum. So when the teacher informs the parent says, "How dare you say my child is autistic? You are not a medical doctor." Unfortunately, or fortunately, being in a very strict environment, the teacher backed out because she didn't want to get into any legal issues. However, that's where the fortunate part comes. 1 week later, the parent comes back and asks the teacher, Tell me now what to do. Beautiful people, it is very important to understand autism manifests in the form of behavior. So when we talk about behavior, it is the parents, okay, who are the primary caregivers, followed by it could be even the caregiver, the maids, the school teachers, the teachers which are varied. We are talking about teachers in our cultural world where we have PDK teachers, right? We have PPKI teachers, and they would be able to see something amiss in the child. All right, sexuality. In Malaysia, all right, generally, as I mentioned earlier, the age 3 to 7 and then 9 to 12, where you start feeling, you go through feelings, there's a lot of ways of expressing these feelings. However, we are actually monitored, or what shall I say, we are chained by cultural differences. How an Indian views sex is different, how a Chinese, how a Malay, and all the other races. So the culture is a very important element in sexuality. Now, beautiful people, please do not be too distraught with these words. But since we are on sexuality, I have to be very open in my sharing. And these are the words that are normally related to sexuality. We have heterosexuals, right? That's the normal attraction. We have pedophiles, which is the attraction towards children. And then you have hypersexuality, sexual fantasies or urges that are difficult to control. And then during these kind of feelings, they have labeled it. Now, before I indulge into that area, let's just put a comma and look at autism. Of course, if I want to give you the definition, as I mentioned earlier, even when I use the past tense, I use the word arios as in the past tense, which is a Greek word. So autism comes from the Greek word autos, which means self as opposed to the real world. Now, it is very important to remember this. The confusion, autism was actually seen as early as 1798, you had 1873, then it went down to 1943, 1944. But the point we are looking at is this. The history of autism, you would be able to see the history of autism goes through this phase. Could it be schizophrenia? Is the child culturally people have a tendency to say, oh, it is something maybe from God. And another set of people who will say maybe it is a testing and we are being tested. And then you have the scientists who went through so many stages and schizophrenia, and that went on for quite some time till 1943 and 1944 when the division became a little bit more clear. So 1943, Dr. Leo Kanner, when he was looking at 11 children, and this is what he saw. He saw these children echolalic, walking around in tiptoes, maybe hand flapping, no eye contact, non-verbal. So for some time, it was known as the Kanner-like autism. Then in 1944, in Germany, now all this happened in Germany because in Germany there was a lot going on and there were a lot of effects going on. But the second umbrella of autism in 1944 was, let me give you an example. These children will be able to speak very well. However, if we take a Venn diagram in mathematics and we put the first umbrella and the second umbrella together, we are going to see some similarities. But I'm going to give you examples. Now, I was actually teaching, all right, and in the midst of my lecture, This particular individual, with the 1944 interpretation, puts up his hand and says, Madam Ruth, I have a question. I have a beautiful poem for you from Shakespeare. Right. What do the classmates do? Because it is in the midst of lecture and they immediately react with all kinds of sigh and say, oh, why is he disturbing the class? Now, me knowing, all right, that was in the fetal stage of getting into autism, but I still knew he was on the spectrum. Look how I managed the situation. I waited for him to go to the toilet, and when he came back, I told the class, okay, we have 10 minutes. During the last session, you can share your poem. However, when the other lecturers came in, it's a typical cultural reaction. How can you disturb the class? Don't you know that I'm in the midst of saying something important? Only to trigger. Now, beautiful people, we must understand this. This was a child who was very able, speaks very well, looks very good, emancipated, full of knowledge, masses of knowledge. However, what was his reaction? He sent me a text in super duper English damning the lecturer, and he wanted to commit suicide. Now, in 1944, they had a name which was Asperger's. So the Asperger's children, they were able to talk, etc. Now, the question that I wanted to address earlier. What is similar between the first umbrella and the second umbrella? If we draw a Venn diagram, there is difficulty in social communication, social interaction, and repetitive behavior. But the level of social impairment varies from each umbrella. Now, if we want to go a little bit more further, taking off from the brain, you can see in this slide, we have something else that also coexists sometimes with autism. Children may be having autism and ADHD, or autism and OCD. So this is called comorbidity. And of course, if I want to go into the scientific research, there is so much that I could tell you. I could talk to you about the pruning of the brain. I could talk to you about the translating mutation when it becomes shortened. I could talk to you about the de novo. But today, what I am trying to impress on your minds is, before we can even get into sexuality and understand how to actually convey, tell, show, help, guide that child, we need to understand autism in totality. Number one, we need to see autism that exists at different levels. It's very interesting and it's very important to also understand this. When I mentioned it was 1793, and in 2013, under the DSM-5, the Diagnostic Statistical Manual 5, we have autism now that is being put or classified into level 1, level 2, and level 3. So level 1 requires support. That means here, chances are, this would be the child that we would normally verbalize as high functioning autistic child. And level 2 requires substantial support, which could be in between high functioning and Asperger's. And level 3, very substantial support. That means low functioning children, children who are non-verbal, echolalic, etc. Now, these definitions went through so many changes. It is important for us to know that DSM-2 took out X, left Y. DSM-3 did that. And finally, in DSM-5, they have put it into social communication, social interaction, and repetitive behavior. All right? Even social imagination is not put there. So now what happens? Of course, this slide shows strengths. How do I enter a child's world, I want us to imagine, let's look at the column of autism. The child, perhaps, okay, in my 15 to 20 years of dealing with autism, meeting parents, running my executive diploma in autism, talking to different parents, there are children who just love water. There are children who would just like to gaze into a mirror. And their ability to understand, when we go back into the scientific definition of level 1, level 2, level 3, what is their level of understanding? And then there were children who just loved to be with leaves, and another child who would just spend hours looking at a fan rotating, and another one would be so engaged with cups and saucers. Now, we leave at autism, we look at sexual health. Sexual health with autism. The possibility of actually getting into a sexual relationship to be safe. Now, when we say safe, the word safe is very deep. We are talking about the physical, we are talking about the emotional, we are also talking about the communication that goes on. Now, it is very important to be aware that the source of sexuality, where does it come from? We all look for sources. The moment COVID-19 vaccination is introduced, we all are searching. Is this correct? Is there a side effect? What is the source? Is it from WHO? Is it from CDC? Now, when it comes to sexuality, right? The reality is many children, unfortunately, get their education from television and pornography, right? You can see I have also put the referencing in the slide so that we will be able to know of its validity, okay, and reality from a pragmatic sense of view. So what happens is you come up with different terminologies. You have, you may have children who would be asexual, no desire, or maybe just heterosexual, right? Just attracted to the opposite sex, or homosexuality. And sometimes there are cases that I have seen, there is bisexuality. Now, of course, this is the continuation of terms of definition, which I introduced earlier. However, what I would like to identify or bring to attention here is challenges that they face. First of all, children, when you look at the definition of autism, we were saying that they come under level 1, level 2, level 3. Okay, now we are talking about social communication, social interaction, and repetitive behavior. Let's look at social interaction. The norm in our culture, when a child is 6 or even now as early as 3, is to focus on academic. So the academia world sits at the peak of the mountain, because the moment the child is able to do maths, to do science, to do numbers, to be able to do all those different, what we say, abilities, the parent is happy, because this comes down from generation to generation. But we must look at the depth of the word and the meaning of the word social isolation. What does it really mean? A child who goes to school, her child, let me take level 1. He knows his photosynthesis very well, or perhaps his digestion very well. And the teacher poses a question to him. Can you tell me, the food, does it go down your trachea or your esophagus? And when he is posed that question, he gets into a churning of knowledge. He says, Well, yes, I do. The food goes down, your esophagus goes in the first part of your stomach, your duodenum, and then what happens down there? Oh, yes, I forgot to mention there's peristalsis, and it goes on and on and on. Now, what would be the reaction? So the teacher says, no, I only asked you this question, perhaps. But his classmates will come up with another label. Oh, she's only asking one question and he's such a nerd, he's such a show off, he wants to say this. And the child, the poor, I usually use this Malay word, anak emas, this golden child, feels socially ostracized. So that means there is no social communication. He feels because people have labeled him. Now, what about mild autism? So, this is where, when we say the child is mild, we still need to understand the social issues, the depth of the implication when you say there is a vacuum in social communication, social interaction. People do not talk to him. And what did we talk about sexuality? We said a relationship. And what did we talk about the brain? We talked about the ability to say, okay, I'm sorry. I think I spoke too much. Let me give it to another person. So that ability, theory of mind, that there is, I'm talking too much, I'm spending too much of time from the class, I'm going out of point. So there is a rigidity in the thinking, which regulates the emotion. And we haven't even come to the the sensory sensitivities, where some cannot stand light, some cannot stand the touch of cloth, etc., etc. Now, as I mentioned here, I spelled it out. The tactile, when they can't stand touching, and sometimes even when they look at you, there are cases, some of them will look direct eye contact, some may look at the lip, some may look at the ear because of the fixed gaze, right? Some of the gazes are affected, or they may stand too close. And sometimes, okay, this is all based on real life cases. They may wear too loose clothes, or they may look very unkept. And to maintain a conversation, I give you a real life example. Okay, so person A loves dinosaurs. Person B likes dinosaurs, but at a certain level. However, as soon as the topic changes to a new topic, that particular individual cannot keep that momentum. And simple communication. Do you like my new hairdo? Well, get prepared. A child who on the level one, all right, as per just may turn around and tell you, well, I think it looks awful. And that could be because of their rigidity in their thinking, which is scientifically, it is proven. So this is what I do when I teach on the diploma, what goes on in the brain. Because if you do not understand an autistic child's brain, you can have the best program in the world. You will not be able to bring it into the child's world. Okay. However, coming back to my story, when you actually tell the child, okay, or the child turns around and tell you, oh, I think your hairdo looks really bad. So the immediate reaction is, oh, he's very rude, he's very blunt, he's impolite. So there's a lot going on. And then that leads to mood disorder, anxiety, and of course, when it comes to sexuality, if this particular case, I'm going to show you as we get deeper and deeper, that in sexuality, sometimes they will be some children will be locked up in their rooms and they would be totally engrossed into pornography, and they would be sometimes into that whole scene of what they see. So there is a lot going on, something that they cannot control. And the moment they step out, it's all about the expectations of the beautiful parents. Have you finished your maths? Have you finished your science? And that part of that area is left unattended to. Issues. So children, okay, now This is a very, very common scenario where children need to engage in self stimulation, or if the word masturbation. Now, what happens is that that is a very, very common thing. And normally, parents are embarrassed and they don't know how to manage that situation. And then you have a situation where, for example, a high functioning child, he likes this particular girl and he doesn't read the signals. She doesn't answer your call, or maybe she doesn't respond to it. And with such great innocence, because there has been no guidance, the child persists only to be labeled with unnecessary names which are not warranted, because when you come back to the source, it was the failure in not understanding the child's challenges. Now, in terms of sexuality for ASD, this is what research has shown, that women with ASD seem to have poorer levels of sexual functioning, feel less, and compared with males, they do it in solitary sexual activities, and they have a great desire, all right, dyadic kind of relationships. But beautiful people, it's very important to understand research is always based on a study. So they will do it on a group of people. It is not across the board. And then this is another area. As a consequence, sometimes you will have the LGBT, you will become a victim. Okay, there was a true life case where this beautiful girl was actually molested by a non-autistic child, and that beautiful child was not able to say what went on. But thank God there was a witness, and that witness conveyed it to the parents, who then proceeded to do what was necessary. Of course, when we talk about sexuality, we have lots and lots of terminologies. Okay, so we have, which we are going to see in terms of sexting, they call it, and making calls. And in this slide, he tells us, showed some kind of inappropriate behavior. So it's more related to masturbation, indecent exposure. Perhaps you are 10 years old and 11 years old, and suddenly you just lift up your blouse or your skirt because you're unaware of what is socially appropriate. So this is again based on statistics, what happens to the child. Now, it is also important, before we look into how to help the child, what goes on, because you have hypersensitivity. Soft physical touches sometimes can arouse, and then you got the hypo, which takes a little longer. So you see, when you talk about a relationship, when you actually get into sexuality, when you talk about relationship, how much of each other does one understand? In actual fact, when you go back to the original definition by Dr. Leo Kanner, why did he dismiss schizophrenia? Because he said, or he observed, that these children did not seem to have a reciprocal behavior. I want to drink, I want to go out, I'm tired. Madam Ruth, can you stop talking? So it's very reciprocal. So he noticed they could not be schizophrenic as in a full definition, because schizophrenic people are able to express themselves. It is just that they have issues in terms of their thinking, which sometimes is linked to hallucinations. Now, in this report, okay, this report was done, teacher report, and they came up with a solution. And this is what they proposed. People with autism at all levels of severity experience sexual drives, behaviors, or feelings at which point they need assistance. And parent involvement is important. Participation is a crucial ingredient. Number one, it must be taught in a structured, individualized way. Number three, look at the key noun, or I can even call it an adjective. Priority, must be a priority from young so that the child will be able to manage. And it must be done in a specific, individualized manner. Of course, we must also be kept aware that medication, because I'm aware that sometimes when medication is used to arrest meltdowns because of constant meltdowns and temper tantrums, there are side effects. And the side effects, as shown here, sometimes it causes a decrease, and sometimes in the process of masturbation, because of not being able to attain orgasm, they do it repetitively, which may end up resulting in self injury. What is the legal implication in Malaysia? Sorry, legal implication. You see, the involvement of individuals. There is one particular case that we will see shortly, that children, as they are not armed with the do's, the don'ts, with different techniques, with different interventions, they may become victims, as in this case, which I will show later, whereby this young man who's very able, very clear, and when he just posed a question to his colleague, I don't know, I want to understand sexuality, and she advised him, watch pornography. And what happened was, this was in America, they broke into the house and they charged him for handling or in possession of child pornography. And he was actually looking at them and asking them, did I do something wrong? Did I kill somebody? Did I murder somebody? He was not even aware. Of course, here we have Section 292 of the Act 574 of the Penal Code, which has some form of uh, rule, okay, in leakage of information, but still there are no specific laws for understanding and guiding and helping and not letting this beautiful child to be victim of the legal system because we fail to manage to help to guide the child on the spectrum. The person with ASD must learn how to initiate. Okay, what must the child learn? Know boundaries, develop listening skills, understand the meaning of consensual sexual activity. Here again, we have to go back to the level of autism, the level of understanding the boundary at which the child is found. So there are many ways. Of course, we have interventions that has been passed down globally, social stories, and they use different ways. This is you have to put your trousers not in public. It is okay. You have to. So they come up with different do's, don'ts. They tell you to say it positively so that you don't infiltrate the child with negative thought, because it all comes back to the brain. So when I teach developmental psychology in my executive diploma, I let parents understand, let parents realize, where did this intervention come from? Why did they say that you need to give a reward? Why do we say we need to distract the child? Without understanding that, you can have the best therapist, but that particular therapy may not suit that particular child. If you do not understand the shortcomings or the impairments of your child. The reason being, the needs of an autistic child is unique. So therefore, we have to be very worried. They may be victims of sexual crime, and they may have committed a social error as undesired touching because it's very instinctive, but they did not mean it. And before you know it, they are hushed into prison, and they are in the open of the social media and accused, etc., etc. How to help? Okay, these are the cues. Okay, in terms to teach them in terms of hygiene from young, so that they don't develop any kind of unnecessary diseases. Show them what is the meaning of a phone call, how to manage it. But the challenge here also lies where parents are very uncomfortable. Okay, that's one. Culturally, teachers should be empowered and to remain objective. You see, Why am I doing what I am doing now? Why am I even doing this research? Because my vision after 15 to 20 years and dealing with parents from all walks of life, right to the oldest being a scientist, to a doctor, to perhaps a parent who may just have a child who may come from a background is a lorry driver, to understand their beautiful child in the simplest way and to be able to, this is the key word in autism, collaborate. If you're working with the teacher, you need to collaborate. If you're working with the caregiver, you need to collaborate. So here, the pragmatic approach, of course, you learn, you understand, you maintain open relationship, you talk about it, right? Of course, this is what I mentioned, sexting. Sometimes children don't know, like I said, like I mentioned earlier, which is reiterated in this slide, which leads to a lot of issues. And this is the case study where I mentioned earlier, where they bombarded him and they found him in possession of this. So the suggestions, you need to have a particular community. You need to have discussions. You need to talk about it openly. You need to associate it with comorbidity as well. And then we need to put all the case studies. So that is what I do in the final module when I empower whoever comes to get themselves empowered so that they would know how to manage this. So these are a few of the suggestions. And this is actually a clip of a talk which I did in UITM, which is still up. And this was so beautifully done of the do's and don'ts. Okay, so you can see it is written here what are the medications which I talked about and how women have it more. It's just being paraphrased and what should be done. You learn how to communicate. There's pictures to guide you, step 1, step 2, step 3, and so forth. All right. So with this, okay, this is, I call them environmental surgeons. These are the host of teachers from Bahagian Pendidikan Khas, together with some PDK teachers in which they came and studied with me the Executive Diploma in Autism, which is a very simple, non-academic, hands-on diploma so that parents can start collaborating with the top therapists, with the PDK teachers, with everyone so that their child will be able to assimilate, will be able to deal with every issue, right from sexuality issue to functional issues. And I call all of us environmental surgeons because, as I showed the brain just now, we are not able to perform surgery, all right, to correct that impairment in the brain. So we become the environment, and if we are not empowered, and if we do not know and we do not learn, these beautiful children will become victims of a society that is clueless, who will just hang on to therapists without realizing their role and how they should collaborate and work together. Thank you very much. Viren, back to you, Viren.
Thank you for the wonderful speech. Thank you for that lecture, Madam Ruth. Okay, we'll be carrying on to our now Q&A section. So if any of you beautiful viewers have any questions you would like to ask, this would be your time and section to broach it. Okay. The first question we have, Madam Ruth, which
Yes.
is, at what age do autistic children develop their feelings?
Okay, thank you very much for the brilliant question. In reality, based on scientific research, it's 2.5 years when they start feeling. Okay, there's feeling, they know there is sensation. But if you push it a little further, because I understand what the feelings that have been talked, it can be as early as 6 7, 8, 9. But my advice is this, based on the development of the brain at the age of 3, because at the age of 3 is when you are able to actually see whether the child is on the spectrum. So my kind advice, start early. Teach the child the do's and don'ts early. Thank you.
Thank you for that response, Madam Ruth. We'll proceed then to the second question, which is what kind of people are suitable for them as a partner?
Okay. You see, I always start off my lecture by saying we play God. All right. When it comes to autism, as we have seen the brain, we have seen the anatomy, the physiology, and the chemistry of the body, each child is different. That means every child has an impairment that varies from individual to individual. So, of course, there have been lots and lots of, even on Netflix, you would find they would actually encourage, when you actually look at the therapist, they would encourage if you have a relationship because of the rigidity in thinking, to encourage them to have common interests. If person A likes books, that partner probably also could like a book, so that there would be a common interest. But you see, there is a lot of complexity. It does, because when you talk about a relationship, like I mentioned earlier, there are many areas that we need to cover. At the same time, I have cases where you have high functioning people who have actually got into a relationship with a person who is not on the spectrum. So then all, how do I say, all heaven breaks loose. I won't use the word all hell, because that person may be misinterpreted to be a narcissist, a person in control, wants to have a say in everything. It is because of their rigidity in thinking. Thank you.
So that means it takes an open mind to want to have a partner with an autistic person. That's why you're telling me. Okay.
Yes, I love this question. Yes, I have. And it actually happened in my class as I was lecturing on autism. And I think I was raising awareness, and thank God they were high functioning. So when I had completed the class, both of them came and sort of chatted with me, and I gave them little strategies for husband and the wife to manage and to communicate, and in the event there is any issue, to come back to me. Yes, I have.
Thank you, Madam Ruth. Now I think that will cease this Q&A section for today.
Okay.
Well, thank you, wonderful viewers. Before we end our section, we do want to give a prompt for Madam Ruth's questionnaire again to glean the relationship between the autistic parents who have autistic children. So, if anyone who has any relative or friends that do have this in common, that have children and parents that have autistic children, you can happily share this with them. That's all for today's section. Thank you, Madam Ruth, for
Thank
your
you very
time
much.
from your busy schedule. I'm very intrigued with your slides. That's why I've changed my shirt to blue, because
Oh,
if you
okay.
want to know, blue is actually the international color, sir.
Yeah,
International
for
color.
autism. Yeah.
Autism. That's why y'all can do is wear blue to show your support for autism, and that's international color for autism. Thank you, everybody. Don't forget to hit the like button, share with anybody that you know about this live in YouTube live and also Facebook live. That's it from me. And so if there's anything, any faults of me, because it's my first time doing a moderator, so if there's any problems, I'm sorry. It's fine. Okay, that's all from me. Thank you, Madam Ruth.
Thank you. Thank you very much.